Greetings, fellow explorers of the human body and the mysteries it holds. Today, we embark on a journey through the intricate landscape of diabetes, a condition that impacts millions worldwide. For too long, our understanding was limited to a few well-known territories. But now, just as astronomers discover new planets, medical science has unveiled a new, distinct form of diabetes, profoundly altering our map of this complex disease. Prepare to delve into the universe of diabetes, from its familiar constellations to its newly charted territories, culminating in the fascinating story of type 5 diabetes. The diabetes universe, a tour of its diverse forms. First, let's establish our baseline. For many years, we primarily recognized three main types of diabetes. Type 1 diabetes. Imagine your body's immune system as a vigilant defense force. In type 1, this force mistakenly attacks and destroys the insulin-producing beta cells in your pancreas. This often begins in childhood or adolescence, though it can appear later. Without insulin, your body cannot properly use sugar for energy, leading to symptoms like increased urination, excessive thirst and hunger, and unexplained weight loss. The treatment is typically daily insulin injections or an insulin pump to replace what the body no longer produces. Type 2 diabetes. This is often a story of resistance. Your body either doesn't use insulin effectively, insulin resistance, or doesn't produce enough of it. While often associated with adults over 40 and factors like obesity or a sedentary lifestyle, it's increasingly seen in younger individuals. Symptoms can be mild or absent initially, but may include dry mouth, constant thirst, poor wound healing, and blurry vision. Management typically involves lifestyle changes, oral medications, and sometimes insulin. Gestational diabetes. This type is a unique phenomenon of pregnancy. Hormones produced during gestation can cause insulin resistance. It usually resolves after childbirth, but it significantly increases the mother's risk of developing type 2 diabetes later in life. It's often detected through routine screening because symptoms are frequently absent. Beyond these major players, our understanding has expanded to include several less common forms. These include monogenic diabetes, such as maturity-onset diabetes of the young, MO, and neonatal diabetes caused by specific genetic mutations. Latent autoimmune diabetes in adults, LADA, sometimes called type 1.5, which is an autoimmune process like type 1 but develops more slowly in adults. Type 3C diabetes, which results from pancreatic diseases. Other forms like steroid-induced diabetes, cystic fibrosis-related diabetes, and Wolfram syndrome. And let's not forget prediabetes, a critical warning sign where blood sugar levels are elevated but not yet high enough for a full diabetes diagnosis, signifying an increased risk of developing type 2 diabetes. The sheer diversity of diabetes underscores that it's not a single monolithic disease, but a spectrum of conditions, each with its own unique genesis and management needs. The Enigma solved, unveiling type 5 diabetes and its history. And now, for the groundbreaking news. We have formally classified a new, distinct form of diabetes, which we call type 5 diabetes. In April 2025, the International Diabetes Federation, IDF, officially recognized malnutrition-related diabetes as type 5, marking a pivotal moment in our medical understanding. What is type 5 diabetes? Imagine a body, often young, that has endured profound nutritional hardship. Type 5 diabetes is caused by chronic undernutrition, particularly during critical periods like childhood or adolescence. This prolonged lack of adequate nourishment impairs the development and function of the pancreas, ultimately reducing its ability to produce insulin. This is a fundamentally different mechanism from type 1 diabetes, autoimmune destruction, and type 2 diabetes, insulin resistance, often linked to overnutrition or obesity. This condition primarily affects lean, malnourished teens and young adults, predominantly in low and middle-income countries, particularly across Asia and Africa. Its prevalence is significant, estimated to affect 20 to 25 million people worldwide. While patients with type 5 diabetes share classic symptoms like frequent urination, excessive thirst, and unexplained weight loss or muscle loss, several key features help distinguish it. Patients are typically lean or underweight, with a BMI often below 19, a direct reflection of their history of chronic undernutrition. They often exhibit muscle wasting and poor growth, stark indicators of long-term nutritional deprivation. Unlike type 1 diabetes, these patients are less prone to diabetic ketoacidosis, DKA, even when they have severe insulin deficiency. Standard insulin therapy may not be as effective as in type 1, and management places a significant emphasis on nutritional rehabilitation in addition to blood glucose control. A look back: the history of malnutrition-related diabetes. The concept of malnutrition's link to diabetes isn't entirely new. It has a complex and often overlooked history. Before its recent official classification, what we now call type 5 diabetes was recognized by other names and faced a period of being declassified. Early recognition, 1950s to 1980s, researchers observed diabetes in young, lean, undernourished individuals, particularly in regions facing poverty and nutritional scarcity. It was sometimes referred to as J-type diabetes after being described in Jamaica in 1955. The World Health Organization formally recognized it in 1985 as malnutrition-related diabetes mellitus, MRDM. The WHO even set criteria for MRDM, including onset before age 30, high fasting glucose, BMI below 19 kilograms meaty, evidence of malnutrition, and absence of ketosis even without insulin. Subtypes like fibrocalculous pancreatic diabetes, FCPD, and protein-deficient diabetes mellitus, PDDM, were also identified under the MRDM umbrella. The period of declassification, 1990s. However, in 1999, the WHO removed MRDM as a separate category. The main reasons were insufficient scientific evidence at the time to conclusively prove malnutrition as an independent cause, diagnostic challenges, and overlap with atypical presentations of type 1 or type 2 diabetes. This decision had significant consequences. Without a distinct category, many patients were misdiagnosed as having type 1 or type 2 diabetes, leading to inappropriate or ineffective treatments. Renewed understanding and reclassification, 2000s to 2020s. Recent scientific advancements have revolutionized our understanding. Studies have now conclusively shown that malnutrition-related diabetes possesses a unique metabolic profile. It's not just a variant of type 1 or type 2. It's characterized by a profound defect in insulin secretion rather than simply insulin resistance. This evidence, coupled with a clearer understanding of how chronic undernutrition can structurally and functionally impair the pancreas, paved the way for its re-recognition. This culminated in the IDF's landmark decision in 2025 to officially designate it as type 5 diabetes. It is crucial to emphasize that type 5 diabetes is not the same as MODY5. MODY5 is a rare, genetic form of monogenic diabetes caused by a mutation in the HNF1B gene, often presenting with kidney and pancreatic abnormalities and a strong family history, none of which are typically associated with malnutrition-related type 5 diabetes. Distinguishing them is vital for correct diagnosis and treatment. A new horizon. What type 5 means for patients. The official recognition of type 5 diabetes is far more than a mere classification change. It represents a paradigm shift with profound implications for millions of patients globally. Access to appropriate care and diagnosis. For too long, individuals with malnutrition-related diabetes suffered from misdiagnosis, receiving treatments that were not optimal for their condition. The new classification means patients are now more likely to receive an accurate diagnosis and care specifically tailored to their unique physiological needs. Targeted treatment approaches. Because type 5 diabetes is characterized by severe insulin deficiency, but often with high insulin sensitivity due to the lean body habitus, treatment strategies will focus on nutritional rehabilitation as a cornerstone. Some patients may benefit from oral medications rather than insulin injections, which is particularly significant in resource-limited settings where insulin can be expensive or hard to access. The aim is to correct the underlying malnutrition while carefully managing blood glucose. Reduced misclassification and improved outcomes. By reducing misdiagnosis, patients can expect better blood glucose control, fewer complications, and a significantly improved quality of life. This tailored approach promises to be more effective and safer. Global health equity. The recognition of type 5 diabetes brings a much-needed spotlight to a historically overlooked and underserved population. Millions of lean, malnourished young people in low and middle-income countries. This formal classification integrates them into global health strategies, ensuring their specific needs are addressed. Development of guidelines and education. The IDF has established a Type 5 diabetes working group, specifically tasked with developing formal diagnostic criteria, therapeutic guidelines, and educational resources. This ensures that healthcare professionals worldwide will be better equipped to identify, understand, and manage this distinct form of diabetes. Increased research and awareness. With a dedicated classification, a global registry, and focused research efforts, there is immense potential for accelerated discovery of new therapies, a deeper understanding of the disease's mechanisms, and ultimately improved long-term outcomes for those affected. In essence, the recognition of type 5 diabetes is a testament to the relentless pursuit of knowledge in medicine. It empowers patients with precise diagnoses, opens doors to appropriate and potentially life-changing treatments, and ensures that no one is left behind in the grand endeavor of global health. The future of diabetes care is becoming ever more specialized, illuminating the path to a healthier future for all. Thanks for watching. End of transmission.